our heart story written in lines and the waves. This is the language of the heart. If you are able to understand this language, then ECG interpretation is very easy for you. But if ECG ever confused you, watch the snippets. All understand about the ECG basics. We have P, Q, R, S, T. P represents the atrial depolarization, means here the atria started to contract. QRS is ventricular depolarization, where the ventricle started to contract or atria started to relax. Then we have the T. T represents the ventricular repolarization, where the ventricle started to relax. Okay, so now the P is for 0.08 to 0.12 second, 0.08 to 0.12 second. Then we have the QRS. QRS should be less than or equal to 0.12 second, or maybe you can say that less than 3 small squares. Then we have QT. QT is 0.36 to 0.44 second, and we have PR interval from 0.12 to 0.20 second. So here we have P 0.08 to 0.12 second. QRS is less than 0.2 second or less than 3 small squares. Then we have T. T is from 0.1 to 0.25 second. So this can be variable. Now PR is 0.12 to 0.20 second, and the QT interval is 0.36 to 0.44 second. So now let's understand in ECG what are the small boxes, large boxes, how to calculate the rate, rhythm, everything. Okay. So before understanding about the ECG, we should know some basics of ECG. So in ECG paper, you will see this type of one large box. One large box is equal to 5 small squares, right? And it has vertical axis and it has horizontal axis. On vertical axis, this signifies the amplitude or the voltage, and on the horizontal axis we have time. So if you describe this is just the small box, right? This small box. Now if we take the vertical size, so if we have this vertical side will take as the amplitude, then we have 0.1 millivolt. Small box. In this small box, this 0.1 millivolt. Or if you calculate it in the large box, there are 5 small boxes. So if we multiply 0.1 millivolt with 5 small squares, then it will be 0.5 millivolt. So in one large box we have 0.5 millivolt, right? And in the small we have 0.1 millivolt. So we have 1, 2, 3, 4, 5. So we have 0.5 millivolt in the one large box. Now coming to the time is on the horizontal axis. This is the horizontal axis. Now one small box is 0.04 second. So 0.04 second, if we calculate for the one large boxes, where in one large box we have 5 small square, if we multiply this with the 5, then we have 0.20 second. So this one small box having 0.04 second, and if we take the whole large box, then it is 0.0 second, and the voltage of the whole large is 0.5 millivolt, and of the small one it is 0.1 millivolt, right? So if I'll take the small square out of this large one, like this is the small square out of this large one, this small square has on the vertical axis 0.1 millivolt, and on the horizontal axis is 0.04 second. And if we calculate for the whole, then it will be 0.5 millivolt and 0.20 second. right? So in the one large box we have 0.20 second, or the 5 small square, or this is 5 small square. This is the voltage in one large box, and 0.20 second in one large box, right? Calculate the heart rate. So heart rate is calculated in the regular or irregular rhythm. There's a different formula for this. If I calculate in the regular rhythm, there are two things. If I'll calculate with the small square, or if I'll calculate with the large square. If I calculate with the small square, then there's a formula is this heart rate is equal to 1500 divided by number of small square between the two RR consecutive RR waves, right? So 1500 divided by I'll calculate the number of small boxes between two RR. Then second is, if I'll calculate with the large boxes, then I calculate by heart rate is equal to 300 divided by number of large boxes between two RR waves, right? Now there's another formula for the irregular rhythm, when you have the irregular rhythm. So what we'll do in that trip, and we calculate the number of RR waves, right? So then the formula will be heart rate is equal to the RR 60 beats per minute. So in the irregular, this is 60 beats per minute if I have this 6 R in the 30-second strip, right? So this is the method for the regular or for the irregular rhythm. Now I'll tell you about the different ECG leads. ECG leads are unipolar and bipolar. In the unipolar leads, we have limb leads and chest leads. In the limb leads, we have AVR, AVL and AVF. And in this chest leads, we have V1, V2, V3, V4, V5 and V6. These are the chest leads, or you can say the precordial leads. Now these are the unipolar leads. Now bipolar leads. The bipolar leads are 1, 2 and 3, right? So the ECG leads are bipolar and unipolar. So in bipolar we have 1, 2, 3, and unipolars are also divided into this limb leads and the chest leads. In the limb leads we have AVR, AVL, AVF, and the chest leads we have V1 to V6, or we can say the precordial leads, right? Okay, now understand this all things by the Einthoven triangle. Like this triangle, this is the invisible triangle you will see, but this is very important to understand the different. I make you understand some of the important ECG basics. So if I make you understand this topic, please write yes on the comment section. See this reel, I'll come with the Einthoven triangle in the next video, so follow for me.